Most of us know what it feels like to be a little down, but when that feeling crosses over into outright depression, the right kind of help is critically important. We spoke to Dr. Jonathan Alpert at Massachusetts General Hospital, a nationally ranked center of excellence in psychiatry, about the key symptoms.
Depression can present in different ways. There are biological changes that are very consistent among people who are depressed.
Those include feeling down, trouble with sleep, feeling tired, poor appetite or overeating, trouble concentrating or making decisions, moving or speaking slowly, feeling fidgety or restless, better off dead. People who suffer from depression often complain of physiological problems such as headaches, nausea, shortness of breath, new unexplained aches and pains, or frequent urination. Be aware that depression shows up differently in different people.
One person may be very withdrawn, very quiet, very slowed down, may have lost 20 or 30 pounds, may be sleeping only 3 or 4 hours a night. Another person may be intensely irritable, may be getting into fights with people at work.
Depression can be a hard diagnosis to make, which is why it's important to see a highly qualified professional.
A psychiatrist is a physician who's specifically trained to recognize, be able to evaluate, and be able to treat symptoms of mental disorders.
Many depressed patients also suffer from anxiety.
4 out of 10 people with clinical depression also have an anxiety disorder.
Up to 20% of depressed individuals will experience manic symptoms such as decreased need for sleep, increased energy, rapid thoughts or speech, and impulsive behavior. Missing this diagnosis can have very serious consequences. If you feel your diagnosis doesn't fit, challenge the diagnosis and insist on a complete workup.
Depression often is a complication of having a chronic illness. There are many illnesses such as multiple sclerosis or Parkinson's disease or systemic lupus, other kinds of conditions that often go on for many years and require extensive treatment, in which we find that there's a very high rate of depression.
Finally, many depressed patients present with a dual diagnosis of depression and substance abuse. The good news is that depression is a highly treatable disorder. The earlier the diagnosis is made, the better.